Hello, my name is Hassan Pereira Mesa, and I want to share a unique case that was seen at the University of Florida Shands Hospital. This project delves into the importance of identifying patients presenting with symptoms consistent with toxoplasmosis, not only in the patient populations known to be at risk, like the immunocompromised or pregnant women, but also for those immunocompetent patients who are also exposed to toxoplasmosis in their day-to-day life, specifically deer hunters. This case describes the hospitalization of a otherwise healthy 58-year-old male who presented to the emergency room with 4 days of a myriad of symptoms, including left-sided headache, dizziness, subjective fevers, chills, night sweats, malaise, loss of appetite, and 40-pound weight loss over the last 4 weeks. Initially, his vitals were significant for a fever of 102.9 on admission, but otherwise within normal limits and sitting well on room air. An initial head CT without contrast was obtained in the emergency room, which was mostly unremarkable, aside from what was called chronic microvascular changes. From a physical standpoint, the patient remained hemodynamically stable with no focal narrow deficits. But given the persistence of his symptoms, the patient underwent an MRI to further evaluate the CT findings, which was consistent with prior CAT scan, and then patient underwent an MRA, which also did not show any significant abnormalities. This patient then underwent a spinal tap, which showed a CSF with 33 red blood cells, 8 white blood cells, and otherwise normal protein and glucose levels. He also had negative CSF microbiology and otherwise negative respiratory viral PCR, serologies, and blood cultures. Ultimately, the patient's blood culture's PCR was positive for Toxoplasmosis gondii, and further review of prior imaging confirmed the absence of pathognomonic Toxoplasmosis lesions. At this time, ophthalmology was consulted, and a dilated fundoscopic exam did show evidence of a small hyperpigmented scar positioned superiorly that was, given his blood culture PCR results, were thought to be due to possible toxoplasmosis scar. The other etiologies could not be fully excluded at this time. Following this diagnostic workup, further history elicited reports of consuming undercooked venison while hunting in Georgia about 14 days prior to the presentation. The patient also reported that other hunters had also consumed the undercooked venison, did have similar symptoms, that none require hospitalization and their symptoms resolved. Given the persistence of his symptoms despite his immunocompetent status, the patient was treated with IV Bactrim and clinically improved over the course of the next few days, allowing him to be discharged to complete his course of antibiotics at home. Overall, it's really important to acknowledge toxoplasmosis as the protozoan infection that is actually widespread in humans, with an estimated seroprevalence of 11% in the United States population. While most infections are usually asymptomatic in immunocompetent hosts, toxoplasmosis is one of the most deadliest foodborne pathogens in the U.S., with 2 known methods of infections: congenital, through vertical transmission, or postnatally acquired infections. In this case, postnatally acquired infections happen due to exposure to infected feline feces or ingestion of oocytes or tissue cysts in contaminated water, improperly washed foods, or undercooked raw meat of infected hosts. Transmission of toxoplasmosis in hunters after consumption of raw undercooked venison has actually been reported in Alabama, South Carolina, Tennessee, Wisconsin, and Illinois, but never in the southeastern United States. The prevalence is thought to be around 70% among white-tailed deer in the region. Currently, the U.S. Department of Agriculture recommendations for avoiding toxoplasmosis infections include not consuming raw or undercooked game meat, freezing the meat prior to consumption, or cooking venison to an internal temperature of about 160 degrees Fahrenheit to destroy all cysts and oocytes, and also wearing gloves and or washing hands with soap and water after handling raw meat, as well as cleaning all materials that come in contact with this meat.